I'm really glad you came in today to get this looked at. I know how frustrating and, honestly, how scary it can be when your body starts doing things you don't understand, like your toes swelling up, itching intensely, and turning blue in the shower. First, let me reassure you, you did the absolute right thing by getting that full blood workup. When a patient tells me they have chronically cold hands and feet, my first job is to rule out systemic underlying conditions. We have to check for things like anemia, an underactive thyroid, high blood pressure, or autoimmune conditions like lupus and rheumatoid arthritis. Since all your blood tests came back completely normal, we can take a deep breath. Your overall health is structurally sound. So, what is causing this? Based on your symptoms, the painful swelling from the middle joint to the tip of your toes, the intense itching, and that blue discoloration when you get into a hot shower, what you are experiencing is a classic case of superficial frostbite. In the medical world, we call this chilblains or pernio. Now, when people hear the word frostbite, they usually picture someone stranded on a mountain peak. But the truth is, you can get superficial frostbite just by walking a few blocks in freezing, damp weather if your footwear isn't protective enough, like wearing dress shoes or nylons in the winter. Here is exactly what is happening inside your body. When your skin is exposed to the cold, your nervous system panics a little bit. It wants to protect your core organs, so it severely clamps down, or constricts, the tiny arteries leading into your toes. Because those vessels are locked tight, your skin is temporarily starved of oxygen and nutrients. This triggers a localized inflammatory reaction, which is where that painful swelling and itching come from. And that blue color you see in the shower? That happens because when you expose those cold, constricted vessels to sudden heat, the tiny veins clamp down to trap what little blood is left in the tissue before the arteries can fully open back up. This is actually very closely related to a condition called Raynaud's disease, which is incredibly common in young women. Raynaud's causes a dramatic three-phase color change where the fingers or toes turn stark white because the blood flow shuts off, then blue as oxygen drops, and finally a bright, burning red when the blood finally rushes back in. The good news is that we can absolutely manage this. Our primary line of defense is going to be lifestyle adjustments. Protect your core heat. I know it sounds counterintuitive, but wearing a very warm coat to keep your torso warm tells your brain that your body is safe, which stops it from shutting down the circulation to your toes. Upgrade your commute gear. If you have to walk out in the cold, don't wear your dress shoes outside. Wear insulated socks and boots, and carry your indoor shoes in a bag. Adjust your diet. Try to eat warm foods, which take less metabolic energy to digest and leave more heat for your extremities. Also, we want to avoid vasoconstrictors. That means avoiding tobacco completely, and swapping out your morning caffeinated coffee, which clamps blood vessels down, for green or black tea, which actually contain flavonoids that support vessel health. Supplements. We can also look into adding a daily magnesium supplement to help relax those blood vessels, along with hawthorn berry or resveratrol to keep your vessel walls healthy. For severe cases that keep coming back every single winter, we do have prescription medications that can help. Drugs like nifedipine help relax the blood vessels, and medications like pentoxifylline make your red blood cells more flexible so they can slide through those narrow passages more easily. However, the catch with these medications is that they take time to build up. We usually have to start you on them about 3 months before the winter cold hits for them to work. For right now, since we are already in the middle of it, your main job is strict cold avoidance. If you ever have a sudden flare-up, get indoors immediately and soak your feet in lukewarm water. Never use hot water, as that sudden temperature shock can actually make the tissue damage worse. Let's start with these changes. Keep a close eye on your feet and see how you progress.